We will learn about the following topics. What is the Ontario Health Insurance Plan? And what are the eligibility requirements for OHIP? How to apply for OHIP? Which services are covered by the Ontario Health Insurance Plan and which services are not covered by the provincial plan? We'll also take a look at alternative healthcare options while you wait for OHIP coverage to begin. And this would include private health insurance as well as community and public health centers. What to do after you get your OHIP card. This will include information on finding a family doctor, dental care provider, and learning about patient rights and responsibilities. We will also look into how an individual can lose their OHIP coverage, as well as how Telehealth Ontario plays an important role in providing assistance and support. Finally, toward the end of this webinar, I will talk about the additional resources available for newcomers. Before I go into more details, let me share some background information about COSTI. COSTI Immigrant Services is a community-based multicultural agency that provides services to all immigrant communities, new Canadians, and individuals in need of assistance. COSTI was founded over 70 years ago. Today, COSTI has over 550 staff who are able to provide services in 68 languages. COSTI operates out of 18 locations in the City of Toronto and Greater Toronto Area, including Peel Region and York Region. We have three divisions. They include employment, social services, and education, and offer many programs such as Employment Ontario, housing assistance, language training, and settlement services. COSTI also has services specific for youth, women, and seniors. COSTI offers job search, career counseling, and planning services to newcomer clients. Our bridge training programs include Expressway Cybersecurity Bridging Program, ITI Solutions, Bridging the Gap to Employment, Pathways to Early Childhood Education for internationally trained professionals. Our enhanced language training programs were expanded to occupations including accounting and finance, teaching and education, healthcare, information technology, as well as office administration and customer service. COSTI has partnered with local unions within the construction and trades, and the new enhanced language training Pathways to Trades program helps internationally experienced skilled workers, as well as those who are new to the industry, get training, necessary certifications such as WMIS, and access to unionized jobs. The Planning for Canada program has partnered up with every province and territory in Canada, with the exception of Quebec. COSTI is the Planning for Canada provincial partner in Ontario. To better assist clients in accessing the information and resources before arrival, and more importantly, accessing local newcomer services post-arrival, we have built a comprehensive network and partnership with service providers, including over 150 community agencies, regulatory bodies, professional associations, sector councils, community colleges, school boards, libraries, smaller cities and towns, francophone communities. Now let's get started with an overview of the Ontario Health Insurance Plan by helping answer the question, what is OHIP? In Canada, the government provides basic health care to those who live here and those who meet the eligibility requirement. In Ontario, the government-run healthcare plan is called OHIP, Ontario Health Insurance Plan. This health plan is funded through taxes. OHIP pays for many healthcare services that are medically necessary. These services include visits to your family doctor, specialists, and most basic emergency healthcare services. To find out if a specific procedure or treatment is covered by OHIP, check with a healthcare professional. OHIP eligibility. Who qualifies? With certain exceptions, to qualify for OHIP, you must meet all of the minimum qualifications listed below, plus at least one of the additional requirements. To meet the minimum qualifications, you must be physically in Ontario for 153 days in any 12-month period, be physically in Ontario for at least 153 days of the first 183 days immediately after you begin living in the province. Make Ontario your primary residence. You must also meet at least one of the following additional requirements. You must be either a Canadian citizen or a permanent resident, formerly called a landed immigrant, or or here in Ontario on a valid work permit and are working full-time in Ontario for an Ontario employer for at least 6 months. And if you meet this requirement, your spouse and dependents may also qualify for OHIP. If you are a convention refugee or other protected person, as defined by Immigration and Refugee Board of Canada, if you have a temporary residence permit, or if you are a clergy member who can legally stay in Canada and will be ministering full-time in Ontario for at least 6 months. If you meet this requirement, your spouse and dependents may also qualify for OHIP. In the next slide, we will show you the steps for how to apply for OHIP. Once you are ready to apply for your health card, you can go to a Service Ontario office and get the application form. All Service Ontario locations are open for in-person services. No appointment is necessary. All appointments are on a walk-in, first-come, first-served basis. You cannot apply online because it will be your first health card and your photo will need to be taken in person and on site. You will need to provide the following documents for an OHIP application. You will need 3 separate original identification documents. The documents include one that can provide your immigration status. This could be in the form of a confirmation of permanent residence or landing paper or PR card. One that proves you live in Ontario, such as a rental lease or agreement, utility bill, or maybe a monthly bank statement. And one that supports your identity. This could be something like your passport. Once the form is completed, take all your necessary documents and visit a local Service Ontario office to submit the application. Contact the Service Ontario info line at 1-866-532-3161. Info line staff will advise you on the next steps as appropriate. You will be registered for an immediate OHIP coverage and provided with a transaction record to use to demonstrate your eligibility for OHIP until your physical card arrives in the mail. Next, we will look into which services are covered by OHIP. What medical services does the Ontario Health Insurance Plan cover? Here's a quick summary of the services that are covered by OHIP. In the next slide, I will go into more details about the specific services that are covered by OHIP. OHIP covers many health services you may need, such as appointments with your family doctor, visits to walk-in clinics and some other healthcare providers, visits to an emergency room, medical tests and surgeries. To be covered by OHIP, you must have a medical reason to receive a service or treatment. Cosmetic surgeries, for example, are not covered by OHIP. Going into a few more details about what OHIP covers, doctors. Whether you visit your doctor or if you see one in a walk-in clinic, the Ontario Health Insurance Plan covers the full cost of your services as long as they are medically necessary. Hospital visits and stays. If you need to go to the hospital, OHIP covers doctors and nursing services, services to diagnose what's wrong, such as blood tests and x-rays, medications for inpatients. Once the patient has been discharged, prescribed medications are not covered. Some medications for outpatients, there are certain limited medications that are provided to outpatients for home use. Accommodations and meals. If you must stay and you want a private or semi-private room, you or your private insurance will have to pay some or all of these hospital fees. Abortion services. OHIP covers the cost of surgical abortions that take place in a hospital or clinic. Dental surgery in hospital. Some dental surgeries need to be performed in a hospital because they are complex and or you will have another medical condition that requires monitoring during the procedure. OHIP covers in-hospital dental surgeries such as fracture repair, tumor removal, reconstructive surgeries, and medically necessary tooth removal. Prior approval by OHIP is required. Optometry, which is eye health services. OHIP covers the cost of one major eye exam for vision and general eye health every 12 months, plus any minor assessments you need, but only if you are 19 years and younger, 65 years and older. If you are 20 to 64 years old, and you have a specific medical condition affecting your eyes that requires regular monitoring, OHIP will cover a major eye exam for you once every 12 months and any follow-up appointments related to the condition. OHIP may also cover a major eye exam if it has been requested for a specific reason by your doctor. They will need to give you a referral form. Podiatry, which is foot health services. OHIP covers between $7 and $16 of each visit to a registered podiatrist, up to $135 per patient per year, plus $30 for x-rays. You will need to pay for the remainder of the cost of each visit. Surgeries performed by a podiatrist are not covered by OHIP. Ambulance services. If you need an ambulance for medical emergencies, OHIP covers part or all of the cost, depending on the circumstances for the need of the ambulance service. Travel for Northern Ontario residents. If you have to travel long distance for specialized medical care and live in one of the following areas, OHIP might help pay for your travel and accommodation through the Northern Health Travel Grant. OHIP services not covered by OHIP. OHIP does not cover prescription drugs provided in non-hospital settings. This would include antibiotics prescribed by your family doctor, dental services provided in a dentist's office, eyeglasses, contact lenses, laser eye surgery, and cosmetic surgery. Many employers, over 2/3 of Ontario employers actually, provide extended health insurance coverage, including drugs, paramedical, vision, and dental services. I mentioned in the previous slide that dental care is not covered by OHIP. Although that is the case for many adults on OHIP, there is a program that allows children 17 and under to access free dental care. This program is called the Healthy Smiles Program. How it works: Healthy Smiles Ontario is a government-funded dental program that provides free, preventative, routine, and emergency dental services for children and youth 17 years old and under from low-income households. The program includes regular visits to a licensed dental provider and covers the cost of treatment, including checkups, cleaning, fillings for a cavity, x-rays, scaling, tooth extraction, urgent or emergency dental care, including treatment of a child's toothache or tooth pain, cosmetic dentistry, including teeth whitening and braces, are not covered by the program. Who is eligible to apply? You can apply for your children if they are 17 years of age and under, live in Ontario, come from a household with an income equal to or less than the levels in the table below on the website I mentioned on my screen. Length of coverage period. Once your child is enrolled, they are covered up to one benefit year, August 1st of the current year to July 31st of the following year, or up to their 18th birthday. If your child turns 18 the benefit year, they are no longer eligible. If your child is in the program for emergency essential care, they are covered for 12 months from the date of enrollment. Clients receiving emergency or essential care must re-enroll after 12 months. How to enroll? You can enroll in the program online or by mail. Once your child's enrollment is confirmed, you will get a Healthy Smiles Ontario dental card in the mail. You must present your card to your dental provider at each visit to receive services under the program. If your child or youth meets the eligibility criteria for the Emergency and Essential Services stream of the HSO program, or is already enrolled in the HSO program and requires emergency dental care, please contact an HSO participating dental provider or your local public health unit by phone for assistance. If you have recently applied to the core stream of the HSO program through the online portal or through the paper application, processing of your application is currently on hold. OHIP does not cover the cost of prescription drugs. However, there is a program called OHIP Plus. This program offers more than 4,400 drug products free for anyone age 24 years or younger who are not covered by a private plan. Who is covered? Anyone 24 years and under who has an OHIP card or OHIP coverage and is not covered by a private plan is covered by OHIP Plus. You do not have to enroll or register to access OHIP Plus coverage. How the process works. Patients do not need to apply to join OHIP Plus, nor do they need to pay any upfront costs. Those eligible for OHIP Plus only need to give pharmacists their health card number and a valid prescription for an eligible medication. The pharmacist may ask the patient or their parent or guardian if they are covered by a private plan. What medications are covered? For children and youth, OHIP Plus covers the cost of more than 4,400 drug products that are currently available through the Ontario Drug Benefit Program, including antibiotics to treat infections, inhalers for asthma, various insulins, oral diabetic medications, and diabetes test strips, epinephrine auto-injectors, such as an EpiPen, drugs to treat arthritis, epilepsy, and other chronic conditions, Medications to treat mental health conditions such as antidepressants and attention deficit hyperactivity disorder, ADHD, drugs. Drugs to treat childhood cancers and other rare conditions. Help to quit smoking up to a year of your pharmacist assisted counseling. Talk to your pharmacist or healthcare provider. Drugs such as Champix and Zybin if you are 18 years or older. Now, we will discuss the option for health services that are not covered by OHIP. While you wait for your Ontario health insurance plan to start, you have the option of getting private health insurance or accessing the services of community health centers. Before I get into explaining your non-OHIP healthcare options, I wanted to mention that if you are taking prescription medication, it is very important to remember to bring a 90-day supply to Ontario. Keep the medication in the original packaging and have the prescription available when you go through customs and immigration. If you wear glasses, arrange to get a second pair. If you wear contact lenses, bring an extra supply. In Ontario, there is a cost for eye exams for adults aged 20 to 64 years, which is approximately $75 to $130. Be sure to bring immunization records for everyone in your family, especially for your children. These are mandatory for school enrollment. If the immunization or vaccination information is written in your language, you will be required to have it translated into English. While you wait for your Ontario health insurance plan to start, you have the option of getting private health insurance or accessing the services of community health centers. Generally, the coverage you need is for short-term or visitors to Canada. You need to confirm with the insurance company that they have insurance plans for people who do not have OHIP coverage. Not all health-related expenses are covered by private insurance. For example, pregnancy-related costs may not be covered. So make sure that the plan you choose suits your needs. To find a private health insurance company, you can use the Ombudsman Service Insurance Finder or look online. Another place to find health insurance is through an insurance broker. Insurance brokers are an alternative to insurance companies. Brokers represent several different insurance companies and can tell you about your choices. To find an insurance broker, you can look online. Here are a few more companies that offer private health insurance for newcomers. Please make sure that you do your homework before deciding on a company or a plan. You can ask for quotes and compare the plans and select the best one that can suit your needs. Let's move on to community health centers. Community health centers provide primary care, health promotion, education and illness prevention, services using a community development approach. Healthcare professionals, including physicians, nurse practitioners, nurses, counselors, community workers, and dietitians work in community health centers. If you do not have OHIP, you might be able to get healthcare services at CHC. In addition to providing clinical treatment, community health centers may have culturally sensitive care in different languages, anti-racism programs, sexual health education, domestic violence prevention and treatment, parenting education, support for teenage mothers, and drop-in programs for youth. Services at the community health centers are free or low cost for eligible individuals. All services are confidential, and some, such as tests for pregnancy and HIV/AIDS, may be anonymous. The healthline.ca, this website can help you find health and community services in Ontario. So, once you have OHIP coverage, how can you access healthcare services? One of the first things you want to do after getting your OHIP is to find a family doctor. A family doctor is also called a general practitioner or GP. Family doctors are usually the first doctors to diagnose and treat most medical problems. If you need to see a specialist doctor, usually you need a family doctor to refer you. Family doctors also order laboratory and other tests. Here are two common ways that you can look for a family doctor. You can register with the Healthcare Connect. This program refers you to a local doctor or nurse practitioner who is accepting new patients. You need to have OHIP to use this service and must not be currently registered with an Ontario family healthcare provider. You can register with this program by filling out an online form or by calling 1-800-445-1822. Additionally, there's a 1-800 number, a toll-free line, 1-800-387-5559, or at the website www.health.gov.ontario.ca. You can also use the College of Physicians and Surgeons of Ontario, All Doctors Search. This search is helpful for finding doctors that speak your language or have specialization that you may need. What are my rights as a patient? As a patient or healthcare consumer in Ontario, you have both rights and responsibilities. If a healthcare professional violates your rights, you can make a complaint. Your rights are protected by laws such as the Healthcare Consent Act and the Long-Term Care Act, as well as the Mental Health Act. Some of your rights. In general, as a patient, you have rights to receive safe and proper care, give or refuse consent for any procedure and for any reason. Have a medical professional clearly explain health problems and treatments to you. Participate in healthcare decisions. Ask questions and express concerns. Request a second opinion within reason. Be assured that your personal information is confidential. Request to access your health informational records. Request the transfer of your health records to another medical professional. You may be charged a fee for this transfer. These are just some of your rights. You can find out more information about rights for specific kinds of patients in the link at the end of this article. You can also make a complaint. If a healthcare professional violates your rights, you can complain to appropriate regulatory organizations. For example, if your doctor refuses to give your medical records, you can complain to the Information and Privacy Commissioner. If you believe your doctor acted unprofessionally, you can complain to the College of Physicians and Surgeons of Ontario. A complaint can lead to an investigation of the professional's conduct. Now, we will discuss the conditions that may cause you to lose your health benefits. First, let's discuss how long can a person be absent from Canada and still maintain their OHIP coverage. You may be temporarily outside of Canada for a total of 212 days in any 12-month period and still maintain your OHIP coverage as long as your primary place of residence is still Ontario. However, the ministry does not have extended absence provisions, which are outlined below. Absences outside of Canada. You may be eligible for continuous OHIP coverage during a longer absence when you are away for one of the following reasons: when studying outside of Canada, when working outside of Canada, and when doing charitable work outside of Canada. To be eligible for a continuous OHIP coverage during one of these absences, you must first have been physically present in Ontario for at least 153 days in each of the 12-month periods for 2 consecutive years immediately before the absence. Different physical presence requirements may apply if you are an Ontario student studying full-time outside of Ontario, but within Canada, and you choose to continue your studies at an educational institution outside of Canada. To confirm continuous OHIP coverage during any longer absence from Ontario, you should contact your local Service Ontario Centre before you leave the province. You will need to show a document explaining the reason for your absence as required. For example, a letter from your school, employer, or sponsoring charitable organization. OHIP fraud. The Ministry of Health and Long-Term Care is committed to detecting abuse and misuse of the Ontario healthcare system. What is OHIP fraud? It includes someone knowingly using a health card that is not theirs, someone receiving OHIP services who is aware that as a non-resident of Ontario, they are not eligible, someone who knowingly gives false information to the ministry to become or continue to be an insured person when they are aware that they are not eligible. To report suspected cases of abuse, the public may call the ministry at 1-888-781-5556. Reports can be made anonymously or by sending an email to the ministry. The ministry investigates each and every allegation it receives regarding a potential health insurance abuse. Ontario health insurance coverage is cancelled where health card holders are unable to prove entitlement to Ontario health insurance coverage. Where fraud is suspected, cases are referred to the Ontario Professional Police Anti-Rackets Health Fraud Investigation Unit for investigation and possible prosecution. Under the Criminal Code of Canada, Section 380, a person convicted of fraud exceeding $5,000 could be imprisoned up to 10 years. Restitution may also be ordered under the Criminal Code. Nowadays, there are more and more technology-assisted healthcare services. Telehealth is one of these services, which plays a critical role during the pandemic. Telehealth Ontario is a free and confidential service for health advice and information 24 hours a day, 7 days a week, in more than 300 languages. Through the services, registered nurses assess health issues, provide advice, and direct callers to the most appropriate care over the telephone. This can also include putting the caller in contact with other health professionals or service providers. How it works. When you call, a registered nurse will ask you to answer questions so that they can assess your health problems and give you advice. Telehealth Ontario nurses will not diagnose your illness or give you medicine. They will direct you to the most appropriate level of care or may put you in contact with a health professional who can advise you on your next steps. The nurse will decide whether to handle a problem yourself, visit your doctor or nurse practitioner, go to a clinic, contact a community service, or go to a hospital emergency room. Who can call? Anyone can call Telehealth Ontario to ask a health-related question. What can you ask? You can contact Telehealth Ontario when you have health-related questions or concerns about illness or injury that may need medical care, illnesses that do not go away or keep coming back, food and healthy eating, and you will be connected to a registered dietitian, teen health and issues, depression, suicide, or other mental health concerns. Breastfeeding, refugee health supports, medical assistance in dying supports. What the services doesn't do, it's very important to remember that while Telehealth Ontario aims to help with efficient answers to health-related questions, there are some services and things that it does not do, which is to replace a doctor's visit for an actual diagnosis or prescription. And it certainly does not replace having a family doctor you can build a relationship with. Healthcare Connect is a service that can help you find a family doctor if you don't currently have one. Telehealth Ontario is also not intended to provide emergency support. If the situation calls for it, please dial 911 to have an ambulance or other emergency response sent out and get emergency first aid instructions by phone. That's all we have to talk about Ontario Health Insurance Plan.